tolerate, but once that sort of acute pain is subsided, obviously, that also brings me to the question of flare-ups in the future, and if you could speak to sort of what factors, contribute to flare-ups for people, because we definitely hear that a lot too.
Yeah, yeah. So when it comes to flare-ups, usually the underlying causes are either the muscle strain that you then strain again because you're probably doing stuff in the same offending position, like twisting your body, and the force that you're trying to put on your muscles is too great for the muscle to tolerate. So that's why you're creating that muscle strain, which is very small micro tears in the muscle, and you have an inflammatory cascade that then, causes that pain, the release of the painful factors. Another source of episodic pain is from the discs. So traditionally, this would be a younger individual who might bend over to pick up something and has like an acute flare of pain. It's midline, and if you were to image their back, you would see that the disc has moved out of place a little bit. First, I want to give a caveat to saying that not everybody needs an image of their back. If you were to image asymptomatic people without back pain, the majority of young adults and older would have some sort of anatomic abnormality. So when it comes to imaging, as doctors, we only order it when we're trying to basically plan an intervention, for instance, because a lot of the treatment is generally the same. It's like core strengthening and maintaining physical activity. So say it's discogenic sort of pain, we would also advise them to go through the core strengthening. And the ways to do this are, you could just do exercises on your own. One option is Googling the McKinsey method, and that has 3 main exercises that focus on strengthening that core through static positions, just like holding one position, then as also moving through that to simulate the movements you'd have in everyday activities. But probably what I would find more helpful is referring somebody to physical therapy, just for at least one session, just to have that one-on-one coaching for somebody to examine them going through their everyday movements and seeing if there's any mechanical misalignment in their body, because a lot of times we go through things, we've been doing certain movements the same way our whole lives, and we don't realize that we're actually, like twisted to a side. Maybe we're walking and we're kind of putting more weight on one side that really like places more stress on one side of the spine. So it's helpful to have another pair of eyes from a trained professional to look at that, and then to be prescribed a set of exercises to do. And one thing about physical therapy is that it doesn't take one session to cure your pain. It really is like a prolonged effort, lifelong actually, to basically maintain that strength in our muscles to support our spine.
That's so funny you say that, because I remember going to a physical therapist and they told me to stand still, and they noticed that my one shoulder was higher than the other. And they were like, I can guess which side you hold your bag. I was like, what? Because, we want to, I remember in college, the one-sided bags became popular. I mean, now backpacks are so popular, they come back in, right? So everyone's wearing backpacks now, so maybe perhaps wearing a backpack is better.
One thing that I noticed is that we had a lot of people come in with messenger bag related pain because messenger bags, they're very trendy and cool, but they put all your weight on one shoulder. And of course, you're going to have a lot of muscle tightness in that shoulder, and that can cause a lot of referred pain in that area as well.
Yeah, that reminds me of wearing the white coats as a neurologist in residency, and I had like tons of tools in both pockets because we have our sort of reflex hammer and ophthalmoscope and everything. And it was just carrying, in the beginning of the day, it doesn't feel like much, but the end, you're just kind of like, oh my goodness, I just took off my white coat and it feels like there's a 10-pound weight lifted off. And guess what? There is literally a 10-pound weight lifted off. And I definitely think that's probably contributed, to, and a lot of, as you mentioned, referred pain too. So I think that causes sort of tension in the lower neck and can lead to migraines as well. So these musculoskeletal injuries can really travel and can cause, a lot of fatigue, headaches, just brain fog, and just not, even low mood as well. So they definitely have a lot of trickle down effects. So in addition to building core strength, and continuing active physical life and making sure that you're aligned. What other sort of recommendations would you have, for anyone to prevent? Are you ever really out of the woods? I mean, for back pain, can if you've had it. So I guess another way to ask this is, if you have ever had an episode of lower back pain and you've worked on these things and things get better over time, is it safe to say that you're not at risk in the future, or once you've had an episode, you're most likely, could get sick again, either if you've had a cold or you're dehydrated, or let's say you're just not feeling well otherwise? Have you noticed these things contributing to more flare-ups?
Yeah, unfortunately, I don't think you're ever out of the woods when it comes to back pain, especially for disc-related pain, because the disc doesn't have very much blood supply. It has very little blood supply. And so once you have an injury to the disc, say you have a small tear in the disc, that tear is probably not going to heal. So you're going to be at risk for future flare-ups. So that's why it's just really important to maintain this like lifelong habit of exercising, trying to maintain a good body weight, and work on that core strengthening. And I think I forgot to mention earlier that in terms of specific core strengthening techniques, a lot of times a lot of patients might think that physical therapy exercises are really boring. It takes them away from doing the activities they want to do. Say they want to go running, play basketball, do activities with others, and then now they only have like 30 minutes in their day and they can't do those activities they want to do. They have to do their physical therapy exercises. There's some other exercises that have similar effects, such as yoga, Pilates, Tai Chi. All those also promote dynamic core stabilization, and they also have really nice side effect of like calming one's mood, because we realize that with pain there's actually a lot of inflammatory biomarkers that are circulating in our bodies, and there's this really strong mind-body connection that is emerging more and more in the scientific literature, that shows that if we're able to reduce our mental stress, our anxiety, that also helps improve our pain. Stress promotes muscle tension. We carry a lot of stress in our muscles, and our muscles tighten up. And we know that prolonged time in any one position can cause pain. So not only is just like laying in bed doing work in one position going to cause pain after you like lay there for hours on end, but also just by being stressed, you're carrying that muscle tension a lot, very commonly in the trapezius area, actually, like the shoulders, and people will start feeling the pain over there. And one thing that doctors or even physical therapists might be able to note is that if you feel that area, you'll feel like a very palpable knot, and that could be a trigger point. Basically, you're just having a lot of tightness in that muscle tissue, and one way to get rid of that is via like massage, via dry needling or trigger point injections, and also just relaxation techniques can do stuff long term.